Regenerative medicine is one of the most advanced specialties within medical practice. It incorporates treatment protocols that enhance the human body's self-repair at the cellular level. The objective of these therapies is to stimulate, enhance, and accelerate the processes of tissue regeneration and restoration of homeostasis. Scientific research in the last 10 years has allowed us to understand how cells communicate, identify and respond to signals, and how they are organized in the tissues to accelerate and enhance healing processes. These advances have enabled doctors to manipulate those processes and implement them in the clinical setting. Cell therapies are increasingly being used to optimize the functions of the body and help regenerate muscles, bones, and cartilage. Regenerative medicine now offers an adequate treatment option for chronic and complex diseases, where traditional medicine may not have much to offer. Cell therapy encompasses a wide range of clinical procedures, using products biologicals either fresh or stored, as a regenerative medicine tool for replace and/or repair cells and tissues damaged by natural aging or due to any pathology or trauma. Among the most common cell therapies are the very popular exosomes, amniotic fluid, platelet-rich plasma, and of course the use of adult mesenchymal stem cells. These types of cells are found in almost all tissues of our body, but they have higher concentration in sources such as umbilical cord blood, the stromal fraction vascular tissue of adipose tissue, and bone marrow. These types of therapies are not only competent to form tissues, but are also used in the treatment of neurological, respiratory, and metabolic conditions, in addition to a wide range of chronic and autoimmune diseases. Diseases we are treating through the technique of cell therapy. Autologous mesenchymal stem cells from bone marrow and adipose tissue are used to treat the following diseases: ischemic hemorrhagic stroke, atherosclerosis, obliterating atherosclerosis of the vessels of the extremities, Raynaud's disease, diabetes, diabetic retinopathy, hypothyroidism, osteoporosis, psoriasis, dermatitis, eczema, multiple sclerosis, Parkinson's disease, Alzheimer's disease, cerebral palsy, infantile cerebral palsy, cirrhosis, fibrosis or fatty liver, peptic ulcer of the stomach and duodenum, Crohn's disease, arthrosis, arthritis of the joints, osteochondrosis, bronchial asthma, emphysema, chronic prostatitis, senile tremors, autism. Preparation for treatment with mesenchymal stem cells takes place strictly on an individual basis, according to the plan drawn up by the attending physician. Before starting therapy, the patient undergoes a series of laboratory tests: general blood test with coagulogram, analysis to determine the blood group and Rh factor, blood sugar test, general urine analysis, liver function tests, prothrombin index analysis, analysis for antibodies to HIV, hepatitis B and C, analysis for antibodies to T. pallidum, complex immunological blood test, oncology panel. The use of mesenchymal stem cells of adipose tissue and bone marrow allows you to restore the structure and functions of damaged organs and tissues, as well as normalize the functioning of the whole organism. In some cases, cell therapy is the only way to avoid organ transplant surgery and its associated risks. As a result of stem cell treatment, the need for drugs is reduced, and the patient's quality of life is significantly improved.